Workistic, your work wellness resource on the go. A Thoughts to Inspire interview. At the Work Wellness Institute, the future of work starts with well-being. Dive into our Workplace Wellness Work Bites for summaries of our carefully curated trending webinars, published workplace research findings, and informative interviews with key industry subject matter experts. Learn and stay informed about work wellness anywhere, anytime with Workistic, your work wellness resource on the go. Welcome to our Thoughts to Inspire series, bringing together subject matter experts from across sectors to present evidence-informed, thought-provoking ideas and approaches. These interviews invite conversation and bring attention to the most pivotal and timely workplace wellness topics.
Welcome to our Thoughts to Inspire series, where we interview experts in their field who bring new approaches and new ideas to the table. I'm Dr. Cameron Stockdale. I'm the President and CEO of the Work Wellness Institute. And I'm really pleased to have two guests here today, Dr. Rebecca Gerwurtz and Dr. Emile Tompa. They have a very interesting project that they've started working on. They're friends of the organization. They've done webinars for us in the past, helped us out with some of our research. And so what I would love to do at this point is just get each of them to introduce themselves and a bit of their background and where they work. So Dr. Gerwurtz, we'll start with you. Tell us a little bit about yourself.
Sure. I'm Rebecca Gerwurtz. I'm an occupational therapist and an associate professor at McMaster University. I'm also an adjunct scientist at the Institute for Work and Health, and I hold a PhD from the University of Toronto. And what brings me to this conversation is my interest in work disability policy.
Dr. Tompa, your background we'd love to hear it from you.
Okay. I'm a senior scientist at the Institute for Work and Health, where I've been working for 25 years. I'm also an associate professor at McMaster University in the Department of Economics and assistant professor at the Della Lana School of Public Health. I teach both at McMaster and University of Toronto. I'm also an instructor at Pacific Coast University, which is an initiative run by NIDMAR. Currently, I'm the executive director of Inclusive Design for Employment Access. And my wheelhouse of expertise originally was in policy analysis. I do a lot of economic evaluation and best practice guidance for management systems, through CSA, Canadian Standards Association, and Accessibility Standards Canada.
Awesome. I know, Dr. Tompa, that I use some of your research when I'm sort of justifying proposals and projects around that sort of economic benefit of inclusive workplaces. And that's part of the reason why we've had both of you here today. You're involved in a new project, the Social Innovation Lab, where you refer to it as IDEA. I wonder if you can tell me about that project and how it came to be. And I'll start maybe with Dr. Tompa. I'll start with you on that.
Okay, great. Thanks. Okay. Well, this initiative builds on work that Rebecca and I have been doing for a number of years with academics across the country and internationally in what we describe as the work disability policy arena. A very early piece that I had received funding for from the Social Science and Humanities Research Council was an initiative we called RACWI, our Research Action Alliance on the Consequences of Work Injury. And it was a community university research alliance where we were looking at injured worker outcome, particularly injured workers who had permanent impairments from a work injury. And what we realized was that they were struggling to find the supports they needed to continue engaging in the labor market, to getting all the wraparound supports they needed to live a healthy and productive lifestyle. And they were looking to get supports through various programs that are available at provincial and federal level, and navigating those supports was a real challenge. So our next iteration of efforts was called the Center for Research on Work Disability Policy, and that was focusing really on navigational and coordination issues around what we describe as the work disability policy system in Canada, which for people who know about it, it's really these siloed programs that aren't connected to each other, and navigating them can be a challenge. It takes years of effort and support-seeking efforts, and challenging to do when you have a disability or a work-related illness or injury kind of thing. So we realized the need to kind of have a dialogue across the federal, provincial, territorial kind of jurisdictions to kind of think about how we do a better job of that. that was a 7-year initiative. And towards the end of it, we realized that even when people were ready and willing and able to get back into the labor market, that they were still challenged because employers were not well equipped to do accommodations. They were new to this terrain as well. And so that's where we realized the need to kind of think about the demand side, we call it the employer capacity side, to build up that capacity. And that's how we came about thinking about how we can develop the social innovation laboratory to find solutions for, best practice guidance, resources, and tools to help employers get up to speed on what we sometimes describe as disability confidence, or EDIA, maturity kind of thing. So their capacity needed to be built up to be able to tap into the talent of persons with disabilities that are out there in the labor market, or their talents is being underutilized. And that's how the IDEA initiative came to be. I'll pass it on to Rebecca now, possibly.
Yeah, thank you. So the only thing I would add to what Emile said is that obviously this is a big issue, right? That supporting employers or building their capacity to recruit, hire, onboard, accommodate, promote people with disabilities is a very big undertaking. So we needed a large initiative to be able to tackle some of the challenges that exist in this field that people have been working on for, we're not starting from scratch. People have been working in this space for a long time. But what's unique about this initiative that hasn't happened in the past is that we're bringing people from across disciplines in a partnered social innovation laboratory. And it's through that collaboration of health and social and design and engineering. So health sciences, social sciences, design and engineering, bringing those disciplines together alongside people in the field, employers, advocates, people with disabilities, people with lived experience, employment support organizations, HR professionals, that it's only together that we can really start to develop the capacity that is needed in this space.
Dr. Gerwurtz, I started asking you a question earlier before we started recording, and when I asked it, you started to laugh. So I'm going to ask it again because it sounds like there's going to be a good answer to this. But how did you get involved in this project? What was the impetus for you jumping in with both feet?
So I'm not sure if you're asking like how it unfolded, and I actually think the history that Emile gave around this project emerging from our past work together is really how it came to be. That while we were wrapping up the Center for Research on Work Disability, and the work isn't done, but the funding was coming to an end, and we were finishing what our commitments on that funding, we started thinking like, we're not done. And what is the next important step that we need to do in this space? And that we realized at that point that we need that the group that hadn't received the attention it needed was employers, and that was where we needed to dedicate our work going forward. I think on whenever you're sort of looking at a 6 or 7 year initiative and committing yourself to working on a topic for that long, there's obviously other things that motivate you. And if you're trying to get at what motivates me to do work in this space, it's certainly this deep desire to create equitable workplaces. As a person, as a parent of children who have diverse, learning issues, I'm really committed to seeing Canadian workplaces being inclusive spaces.
Yeah, I might add also that, I don't know, I think the gods of funding were smiling upon us, because just as we were thinking about what we're going to be doing next and drilling down on this idea of thinking about how we can help build that capacity, the New Frontiers in Research Transformation Stream had its inaugural call, which is a tri-council funding agency, and their call was about high impact, high reward, long-term, big initiatives, right? And so we, through our hat into the ring there to compete against. I think it was 400 applications that went in at the front end. They had to be tri-council, so natural, social, and health sciences, which is the kind of work we were already doing, right? And we were connected with the partners and the academics in this space already. And the high impact was really exciting for us too, because our work is very applied. It only is meaningful if it helps generate solutions and change the way we do things in a better way. And this is what we feel we get rewards from, is when our work is picked up in the field. So we're really focusing a lot on working with our partners to identify solutions, prototype them, evaluate them in the field, and then scale them up across the country, across whatever sector that they might serve well, kind of thing. So we're really excited about having this great opportunity through that funding envelope. We were the inaugural group amongst 7 groups that were funded to take on this challenge of doing this high impact, high reward initiative.
So what's the status of the project now? I think it's sort of been in the works for a couple of years at this point. Where is the project? What's happening?
Rebecca, do you want to start?
Sure, it's a good question. I think we're well into year 2, entering into the beginnings of our 3rd year, I believe. Whenever you have such a big undertaking, you need some sort of organizing framework, and we've organized ourselves into thematic hubs to tackle different issues. And I need to pull up what the hubs are called, actually, but one of our hubs is on management systems, and another hub is on employment support systems, and then we also have a hub on transitions to work. And then we have 2 cross-cutting hubs that are meant to do their own work, but also support the work of the 3 core hubs. And our cross-cutting hubs are on disruptive technologies and beyond the built environment. And as an aside, Emile, you can correct me if I've said the titles of the hubs incorrectly. But basically, we've covered this area through these 5 hubs. And the hubs are now working on various projects. We begin all our work by doing rapid scans, because we acknowledge that there is lots of work that has happened in this space. We don't want to start from scratch when we don't need to. We want to build on what already exists. So we start by, looking in the space and identifying existing evidence, existing innovative practices, and then look at identifying gaps potentially that we can work with partners to create new solutions. And by solutions, we mean identifying what's needed. Is it training modules? Is it guidelines? Is it best practices? And develop a prototype that can then be evaluated, scaled, and disseminated. In some cases, we identify that there actually exists innovations. There are innovative solutions that are out there that some people are using, but it hasn't been evaluated or scaled to its full capacity. So we look at what's needed in the space. And that's where we're at right now. We've done these rapid reviews. Many are ongoing, and we're beginning to prototype some of those important solutions that will really help build capacity in the field.
We also had a great launch in May, where we had a day-long gathering of some of our key partners and some stakeholders and a broader audience that came. Some came in virtually. Part of it was in person. Minister Qualtrough spoke at it, Minister Fournier as well, and a number of other keynotes that were really stellar. We're getting them ready. We recorded them, so we're getting them ready for our website. We do have a temporary landing page out there, idea.ca, and our permanent website will be up later this fall. So we're getting a lot of material ready for their website. We're just getting into social media in a big way, because invariably, if we want to have a high impact, we need to be connected with our audience in many different ways. So we're developing all of those platforms and all the material that will be going there, because we're hoping that our website will be a go-to portal for our stakeholders, our partners, and anybody interested in this space to help identify where they can find, resources and tools, whether they're stuff we've developed in-house, or we can point people to other places where they can find these things. Because as Rebecca mentioned, there's lots of great stuff out there. A lot of the challenges for time-crunched employers and other stakeholders is, where do I go to find the stuff that I need to make this work for myself and my workforce, kind of thing? And they don't have a lot of time. So we're hoping that, if they know where to find us and others who are working in this space, it'll serve them very, very well. So all of our kind of outreach, our social media is really ready to be launch out there this fall, and we're hoping that that'll make a good presence for people to get comfortable with where to find these things.
Yeah. I think it's interesting, from the work that we do, there's certainly some overlap. And I think, when we have the opportunity to have a discussion with an employer, they're like, we never knew you existed. And I always point to the Institute for Work and Health and ourselves, that we do research, and there's the knowledge mobilization piece. And why didn't I know about you 5 years before? Yeah. Like, well, we've tried. So the information is out there. I think that, what your point about it being accessible and really getting it into people's hands is an important point. So.
Definitely. Every day when we get a lot of outreach from people who hear about us. We're having conversations on a regular basis, and they tell us about all kinds of great work they're doing. And even I feel like I'm learning something new every day and discovering new websites out there. It's such a complex area of inquiry when you think about all the different actors in the broader work disability policy system, and that connects with broader HR issues, it connects with broader kind of industry and environmental type issues as well. Those all come together to think about what is the way forward for our country, for our workforce, for our industry, to tap into the talent that's out there, to make the most of our futures as a society. And then it connects with international stuff too, because obviously supply chain issues are really important across jurisdictional boundaries. So we are looking into that in different ways, but certainly the scanning, the 5-step methodology that Rebecca mentioned is a really critical part of it. We don't want to reinvent the wheel. We only have 6 years, so we can only do so much ourselves. Yeah. So we want to build on what's already out there if there's some gaps, but just point people to where they can, like whether it's Workwell Institute, the Institute for Work and Health. Some of our partners are doing amazing work in this space, and so we just need to promote it. And I think we need to work together too. That's a really critical thing. I think there's power in working collectively to help each other and support each other, because no one research center or social innovation laboratory is going to do it all, kind of thing. It's about building that connectedness and cohesion and helping the stakeholders in navigating where to find the things that they need in a quick way, so that because they're time crunched and they're constrained and they need to find that stuff in a digestible fashion too. It can't be academic speak. It has to be easy to use, simple guidance that they can distill really quickly. Right? A lot of our audience is small business, right? They have limited resources. Sometimes one person wears several hats. So we want to make sure we can reach those folks in a good way and help them do a better job, because they're struggling. There's a shortage of labor, a talent shortage, and they're struggling to find people who, with the right skill sets. And then when they do find them, they're struggling to figure out how can I accommodate their needs if they're a person with lived experience, kind of thing. They've got great talent, but sometimes you have to do things differently. And what exactly do you need to do differently? It's a bit of a steep learning curve at the front end, building that confidence and getting that maturity of how to be savvy. Not that you have to have all the answers in-house, but that you're comfortable with that you know where to find those answers.
I think that's where, we get a lot of our phone calls from. We get our phone calls from like small to medium employers that have like one HR person. We don't we don't get that from the large corporations with multiple offices who have, their own staff to address these issues. You both come at this from slightly different backgrounds. I know that you two have worked together before on projects. You've laid out some of that. But maybe you can explain a little further how your unique sort of background creates that interdisciplinary approach to this project. You talked a little bit about that earlier, where you're bringing all kinds of different people to the table. I think, Dr. Tompa, you even just said a minute ago, different people sitting around the table is creativity and innovation. That's where it happens. So how do each of your unique backgrounds coming to the table, how do you make this project successful?
Perhaps I can start. I think so health and social science has worked together before, and I think we've achieved really good things working together. We come at things from different perspectives, but ultimately our perspectives jive and they build on each other, and we're able to solve problems that we just couldn't do alone. What's unique about this project is bringing in the third group, which is engineering and design, which is really allowing us to build prototypes, to build solutions. And then the other thing that we haven't yet spoken about, but is so important to all the work that Emile and I and others involved in this initiative do, is that this initiative, the Social Innovation Laboratory, can only possibly achieve its objectives if we include partners in the project. So we can't, it can't just be researchers from the outside trying to solve problems, but we need to work together with our community partners, with the people who are embedded in these systems, from employment support service providers, advocates, disability organizations, employers themselves. That's the only way we can solve these kinds of problems, because it's such a large, encompassing social issue. And we're not the first to start to tackle these issues, but I think the unique thing we bring is not only the interdisciplines, the different perspectives, but also the community and the partners.
Yeah. Perfect. Yeah, no, right on the mark, Rebecca, because co-design is a really central part of how we work. Co-design, working with our partners collaboratively to identify priority areas, trying to find solutions through existing knowledge, and then building on that to solve, and then prototyping those solutions and testing them in the field, scaling. We can't do that without our partners. In fact, our partners have so much great knowledge. We often just listen and bring our methodology toolkits to the table and work with their field knowledge and their experience, and then they are driving the way forward on where we need to go, kind of thing. So we also have a structure that they are co-leading the different hubs with us. So there's a partner lead and an academic lead in each of the hubs. We have an advisory committee that is experts in the field from all facets, from industry, labor, policy, service providers, community groups. It's being chaired by Krista Carr, who's the president of Inclusion Canada. So they are the guiding force for us, kind of thing. But just to speak to that interdisciplinarity and how we kind of work together well, my background is obviously economics is sometimes very quantitative. I do, economic evaluations, impact analysis for regulation, big data kind of analysis. But in the last, I would say about 10 years, with lots of guidance from Rebecca and colleagues, getting in a big way into qualitative research as well, because it's so critical to understanding some of the issues that just haven't been quantified or monetized. That some of the most important things that are for individuals and society have just not been reduced to numbers, right? And so there's so many aspects of our world that we're exploring that need to start off in a qualitative framework when we do key informant interviews, just to hear what they have to say about the key issues, frameworks, development, kind of conceptual models, and then try to think about how we use those frameworks and models to kind of distill some guidance for the way forward, and that we can maybe then measure and evaluate and think about, are we making progress? What are the areas that we're still not doing well in, kind of thing, so it requires lots of different lenses and different disciplines by the very nature of what we're doing, and we couldn't do it without all the disciplines that are involved in this initiative, and without our partners, because they're key to it.
Yeah. And just to add on to that, the other thing that is that's built into IDEA is this idea of mentorship, in that we have researchers that are established scholars who've been doing this kind of work, but we're also including early career researchers and many, many students at different levels, because we need to build this capacity both among the research community to do this kind of work, because it's not traditional in any discipline to actually do this kind of work, perhaps a little bit more in design, but in health sciences and social sciences, we don't usually do such practical, kind of pragmatic, solution focused work. And then also build capacity within our partner organizations to engage in this kind of research. So it's really about building capacity.
Yeah. I think that's critical. This is not like a 6-year initiative ultimately. I mean, maybe the funding is, but what we need to do as a society is change the way we do things, a new normal, where a disability lens is brought to everything we do at the front end. Inclusive design starts at the front end. Certainly we're doing a lot of retrofitting today, and maybe in the short term going forward, but the next iteration of how we are doing things in the world of work and beyond, it has to be inclusive by design at the front end. So that requires a different approach to how we do our work in academia too. That disability lens needs to be brought into management systems, training, architecture, engineering, economics. All of the we need, so that the next generation of people going out into the world of work have that as the new normal of how they see the world. That we need to think about that inclusivity issue, that everybody needs to feel that they have an opportunity, agency, and that they belong, right? And a lot of this has to start in primary school, that we just teach everybody who's of that age that there's opportunities for everybody, no matter who you are and where you're coming from, kind of thing. And so that's where that equity, diversity, inclusion, accessibility comes into play. It has to start from grade school to high school to university, that new normal of inclusivity, and so that people feel that there's opportunities for them regardless of where they're coming from.
I really appreciate something that both of you have been alluding to in this conversation. When you're working with your partners, especially community partners, that they're seen as an equal footing in your research projects and the work that you're doing. So when you as academics go out and you're working on a research project, I think you'd said you're bringing your methodology toolkits to the table, your area of expertise, but you're actually working with your community partners who are doing that work every single day, and you're on the same footing, right? You're listening to their views and their perspective. And I think that collaborative approach, especially in that sort of applied research perspective, is a recipe for success, right? Because at the end of the day, that you're going to get, no might be a bit of a stretch, but you're going to get a tool at the end of the day that resonates with the people who actually use it, right? So I love the approach that you're taking. I'd like to turn back and maybe talk about the IDEA project again. What can we anticipate in the next few months, the next year, coming out of that project? When can we invite you back for a webinar to speak about the project, that kind of thing?
Oh, well, we have lots of projects on the burner right now. We can speak to some of them in some of the hubs. Myself, I'm working with Don Gilland in our Hub 1, which is workplace systems and partnerships. We're looking at developing guidance around accessibility planning and reporting, which is a requirement under federal regulation, the Accessible Canada Act. All federally regulated entities must do that. There's some parallel requirements at the provincial level for provincially regulated entities, but we're taking the lens that all organizations should be doing that. Going back to that notion of continual improvement, part of it of doing, addressing change and gaps and needs is to do it in a structured way. Have a plan, targets, think about how you're going to fill those gaps and what schedule kind of thing. Revisit it, see, measure and evaluate, revisit it, to see, are there still things that need to be tweaked? If you reach those targets, the next iteration, you think about what else can I do to be more accessible and inclusive, and do that on a continual basis. The formality of the reporting is a requirement, making it public, getting input from community groups. The more eyes on it, the better it probably will be, those plans, because the people with lived experiences can speak to the issues that they've struggled with, and they can tell you, okay, well, that might not work so well. You might try something different. So getting that feedback. So we're trying to put a formality to how to do it, because when I was doing, I actually did the impact analysis of the regulations under accessibility planning and reporting for ESDC, and we talked to a few folks, big organizations, and they said, we're lost as to how we're going to move forward in this. We have operations across the country. Each of them are doing different things. I'm not sure how we're going to do this requirement of accessibility planning and reporting. So we figured there was need for some guidance there. Another layer we're going to be doing following this one is looking at supply chains, right? Because supply chains are really critical in multiple ways. Technologies, equipment, HR services, all kinds of reasons. So you turn to supply chains, both nationally and internationally. And how do you take a disability lens to the supply chain? Because you don't want to purchase something, whatever it might be, a service or a product or technology, and then find it doesn't work, or it doesn't work for certain people in your organization, kind of thing. So you want to do that with that disability lens in mind. So those are the two projects we're doing in Hub 1 over the next little while. And we really want to make sure it works for small business as well. So distill it to an essential, approachable, manageable number of best practice guidance principles that a small business can pick up and run with as well. I'll leave it to Rebecca to speak about Hub 2, because she's spearheading that with one of our partners.
All right. So to answer your question in terms of timing and when to have us back, the tools and resources are going to be available over the next 6 months to 4 years, I would say. So different people, different projects will be releasing products and resources that will be available on our website. Specifically within Hub 2, our focus is on building resources and guidance documents for employment support providers, really looking at what it is that is currently provided to employers to support their capacity, and what do employers need from employment support service providers, and trying to identify some of those gaps and building in some guidance documents for that purpose. So we are in the process of doing scans and as well as key informant interviews. But as I said, across the IDEA Social Innovation Lab, there's going to be products and tools released over the next few years, and different people within the laboratory will be leading different projects. And that's how we're going to really move the dial here and have a big impact, is by having many people working on many different aspects of this.
Okay, so I'm hoping we can I want to speak to some of the things the other hubs are doing as well, just to get it out there, kind of thing. So Hub 3, which is transitions to work and career development, they're doing some great work around developing some best practice guidance for workplace stakeholders about how to tap into new talent. Disability focused school to work transition initiatives that emphasize accessing high quality jobs and career advancement opportunities. So really building up that guidance, and hopefully that'll be out there next year, because all of the hubs are really intensely working on these projects currently. We're trying to get these products out the door over the next year. So they're trying to develop that guidance around transitions for school to work that are really career oriented, rather than just getting any job kind of thing, right? So really think about high quality jobs. Hub 4 is doing some really amazing work on EDIA maturity there, canvassing the Fortune 100 companies, trying to learn about what they're doing well, kind of thing. Taking that knowledge and trying to distill it for small business as well, so that they can pick up some guidance around how to do inclusive workplace, best practices at different scales, right? Hub 5 is really working on technologies. They're about the disruptive technologies and the future of work. They're thinking about how you can harness technologies and AI in particular to support inclusive workplace practices around recruitment. So a lot of recruitment is done online. Huge barriers for persons with certain types of disabilities to access those opportunities. They're filtered out because maybe they might have gaps in their CV or whatever. And these are automated systems that just knock out half the candidates who for some reason are a bit different from the average. But sometimes those are the most talented people, right? And so they're trying to help organizations use AI as recruitment in a good way, so that it taps into that diversity in the best way possible. So those are some of the core projects across the 5 hubs. We all have a lot of other smaller projects in different activity areas as well, that'll be coming on stream over the next year. And as I mentioned, our website's going to be open, and we're going to be doing a lot of social media that's more than just research project based, knowledge to practice type stuff, but just having conversations with our partners through, as we're doing here, through podcasts, through webinars, learning about people's lived experiences and the solutions they found that have worked for them, with different employment opportunities, that kind of thing. Just learning from the diversity of knowledge that's out there, and then also kind of pointing people to other great work that some of our partners are doing, and others beyond our immediate circle of partners, kind of thing, so that there's some cohesion across all the great work that's being done by finding a space within our website that we can kind of help point people to where to find the tools, resources, guidance, and knowledge that they may be looking for to do a better job of the EDIA, or disability kind of inclusion, more broadly speaking.
I just wanted to touch on a bit of a reoccurring theme that I'm seeing here, that there's a bit of a patchwork quilt across the country with labor legislation and best practice, et cetera. So I'm interested to see and what idea comes up with at the end of the day around best practice in that area. I sit on one of those technical committees right now that's looking at that labor legislation and looking at Manitoba and Ontario as kind of like, are we going to follow them? Are we not going to follow them? And so I think there's a real opportunity to look at issues like, how do we hire people in an online environment, et cetera? So, like I said, looking forward to what idea is going to come up with when the idea of best practice around labor legislation. I would like to thank both of you for being here today and making the time, sharing your expertise with us today. I found the discussion really interesting, and I appreciate it. And I look forward to seeing what comes out of the project that we've been talking about, the IDEA Social Innovation Lab. I think it's got potential to really make an impact across the Canadian landscape. And so I appreciate and thankful for you picking up that ball and running with it, and again for being here today. So thank you.
And thank you for having us. It's a delight to have this opportunity to speak with you about what we're doing, and we will definitely stay connected.
Thank you very much.
Continue your learning and connect with us at www.workwellnessinstitute.org.